World Health Organization advisor Mary-Louise McLaws joins us now from Sydney. Good to have you on the programme. I want to start with the US. Very worrying figures. The WHO says the Americas haven't reached their peak. And we've just heard a doctor there describing future models, if we don't do anything in the US, as apocalyptic. Does the US have time to avoid such a scenario?
It will be very hard work for them to avoid it. They're responding as if they are 52 different countries rather than 52 states coming together and having a single approach to their fight. So it's very different across those different states, and you can actually see it in the epidemiology. So if you have a look at their curve, they're still sadly on the way up. Their deaths are going down, but the number of cases are going up, and it looks as if I was teaching this to an outbreak class, I'd be saying that there are many different areas within this one country having different scenarios. And we see that just across America, in 24 hours, they can get as many as 30-odd thousand cases in 24 hours. So they are in dire straits. And once upon a time, America used to lead the way. Sadly, they're not leading at the moment. There's very little leadership. It's very fractured within this one very large country.
And there's so much talk of a second wave in many countries, and we know the second phase of the Spanish flu a century ago was deadlier than the first one. Is a second wave coming, and will it be worse?
Well, one of the reasons it was worse during 1918 is because by the time it came back to America, it had changed slightly. Now, this virus has changed a little. It is different across different countries and even slightly different within America. But it would need to change dramatically for us to see this enormous spread as we saw in 1918. And that would require the R0 factor to change, or the infectivity period. So you're infectious for either sooner or longer. However, having said that, we don't know how long your immunity will last. So if you have caught it and it comes around again next winter, we could be seeing as many as 2 or more million Americans still suffering this, and the same for the rest of the world. And that's why we really need America to get on board and come together as one single country, so that as a global citizen, we can try to get this outbreak under control.
And just a question on the human psychology here, because people are tired. Aren't we fighting a losing battle if people do not social distance, do not wear their masks, sit close together when they're out, despite whatever government policy is saying?
Yes, people do get very fatigued, and we saw that nearly happen in SARS, and we see it. We saw it in Ebola. I mean, it's commonplace. But what happens is most people are very logical, and when they hear their authorities ask them to do one thing, but then they start lifting restrictions, then they get confused and they think, well, the authorities wouldn't place me at risk. I must be safe. So they're interpreting the lifting of restrictions as if they're safe. So we need to come together with the authorities and the public to say, actually, you're never safe until we get a vaccine, but we're just trying to get life back to a little bit of normality, or the economy back on track a little bit, but you still have to do certain things. And we've seen even mask use across America to become politicized rather than it becoming part of an infection prevention tool.
Indeed. And as they say, you're never safe until everyone is safe. Mary-Louise McLaws, it's been a pleasure to speak to you on TRT World. Thank you.